Hey, America, we're live. Lisa Berry's on a plane. She's going to Hawaii first and then another country. So you get us.
I think every time I'm on this, it's because Lisa's on a plane. I feel really confident about that.
I think she's actually sometimes we don't actually know and we just say she's on a plane, but she's definitely on a plane, probably right now, because she just said, do you think the Wi-Fi will be strong enough to watch? I freaking hope so, Lisa, because we need some comments. So. We need some comments.
Pay those extra $12.
Yeah, and Lisa, I apologize in advance if this show is not up to your standards. Anyway, okay, here's the deal, everyone. Vin Gupta, Dr. Vin Gupta was supposed to come on our show today because we screwed up his Vive interview so badly with poor audio that we kind of had to give him another shot.
Batteries died.
And now I don't even know what happened exactly there, but he last minute couldn't make it. So yeah, you get us. Also, we were like, hey, Erica, you're famous. You want to come on the show? So we did invite Grace Cordovano too. We figured we'd have patient extravaganza. She's unavailable today, but she can come on whenever she wants. So this show is going to be a little more unfocused than usual. We do have a news deck, but mostly we're just going to bullshit. The first thing I would like to bullshit about today is people sending me dumb emails.
I think we should just nix email altogether, personally, but keep going.
Well, the thing is, I also have a very overly aggressive AI inbox, and often it puts emails to places that they don't need to go. I don't know. It's very confusing, but I really don't do a lot of business on email. Honestly, most of my stuff is on my phone. I text people and I talk on the phone all day, but man, people use email for the dumbest things is all I'm going to say about that. Yeah.
I feel like when you put it in an email, you automatically become more douchey. Because it's formal, right? A lot of people email very formally, so it just comes at even if they didn't mean it that way. I don't know. I feel like there's a lot of other mediums. But okay. So long form, they're not going to do LinkedIn because I think all of us are very tired of the 9 million LinkedIn DMs we get.
Yes.
Where else are we going to get long form? I think that we should normalize sending voice memos. That would be useful.
Oh, I love a voice memo.
Yeah, that'd be cool.
Yeah. Erica, what are your thoughts? What are your thoughts on email?
Email is so formal. It is, and it's so exhausting. It just takes so much more energy. I'm all for text message land. I think that's the best thing that has come to corporate relationships.
Slack.
Yes.
Or worldwide Slack. Worldwide Slack. That's what we should do.
Yeah. Universal Slack. Just Slack me. Because that's agreed. Anyway, but I do want to say I think people often just don't know how to communicate. And I feel like I received 2 really stupid emails today. And the right response would have just not to respond at all. But I feel like I responded less than I could have. And I feel great about that. But, I'm still working on it. But I was just what the actual fuck?
We all need areas of growth. It'll be fine.
Yeah. Anyway. Hey, Sergey, what's going on? I love that guy. Anyway, okay, Erica, what happened this week that was exciting?
I was at Rise. It was fantastic. Got to go both to the Healthy Community Summit and the National Conference in Orlando. Fantastic conversations. Really wonderful.
A keynote, right, or something?
I was. I was the closing keynote for the Healthy Communities event, and that was pretty wonderful. Got to talk about patient caregiver journey, the one that I had personally with my son. And it was just well received. And it was, I think, one of my better ones that I've done. And so it's just a wonderful win.
Yeah, right on. That's awesome. And then you also did last week, I feel like you've been on a bender of being famous, but didn't use, what was the thing you did?
I think I used the term parade. I've been on a parade.
Yeah, you've been on a parade. Yeah. What about the one you did in Chicago?
Yeah, I got to hang out in Chicago with one of my favorite people, Amy Haymans, at the Design for Dignity event. I think they called it Dignified Futures. And it was about human-centered design in healthcare. So just a really interesting audience, lots of wonderful conversations about not just outcomes, but what are we doing as an industry to design everything so that it actually supports the outcomes we're looking for and do so in a way that's human-centered. And it was wonderful, very inspirational in the content. They had some fantastic speakers present there. I got to also talk there as well. I led one of the Ignite sessions and even got a chance to co-host one of the unconference sessions that they held on day 2 of the event with Amy directly. We got to dream about what healthcare looks like in 2050, which was a fun prompt for a lot of the attendees as well. And they just really loved it.
That's awesome. Hey, so do you think we're making progress for patients?
No, I don't think so. Not yet. We talked about it. We're not. We're getting there. There's a lot of lip service, and there's a lot more lip service to this. So I appreciate the momentum and the topics of conversation. But I think operationally, we're still a long ways to go. And I think it really comes down to this fundamental concept of patients don't own their own health data today. And we just don't. And they don't have any leverage in both the economy of healthcare, also the data economy in healthcare. And I think because of that, that stakeholder group just doesn't have a seat at the table, even though we keep saying that we're inviting them.
Yeah. I think about this a lot. Like, wouldn't not all of this, a lot of this be solved if we just like got Congress to like pass a law and say, actually, patients federally own their data?
That would be interesting.
Like, wouldn't that like, because isn't the big issue like everybody's like, well, patients actually don't own their data, which is accurate, right? It's assigned at the facility level. Like, that's the provider owns the data. Like, why couldn't we just like pass a law? I mean, I know that's like actually really hard, but like, what would stop, like, what sentiment would stop that from happening?
So there was another patient advocate, Christine von Rathfield, who I'm good friends with. And we were talking the other day, and she said something like, these vendors can sue each other over my own health data, but then I'm over here broke. And I just thought that was a really interesting perspective, right? That there's all of this litigation happening over patient data ownership and who's have access to what. And at the end of the day, the patients in a large part, especially if you've got any sort of complex or any complex or chronic condition, you're more than likely filing bankruptcy, at least in the short term. And so I just thought it was a really interesting and profound statement that she made around that. And I think that illustrates where we're really deficient as an industry today.
I hadn't really thought about that.
Yeah, that is pretty wild. Like, we do have the largest vendors in our industry suing the shit out of each other right now.
Yeah, over patient data that they don't really should fundamentally own.
Yeah. We got our man here, Sergey. Sergey, it is so sad that Lisa's not here while you're here. I know she's secretly listening, as you can see from her United flight, but like, man, you're the best. Okay. Well, great. Erica, we didn't even introduce you. Tell everybody who you are and what you do.
What do I do? I wear lots of hats, don't I? So hi, everybody. Erica Olinsky. Got some letters after my name. They stand for Board Certified Patient Advocate and Certified Patient Experience Professional. So kind of approach the patient world as an advocate from both the macro and micro perspectives, thinking about how as an industry we can prioritize that stakeholder because they're really important. And not just patients, but also caregivers as well. If we have a patient that survives and the caregiver dies caring for them, were we really that successful? Probably not. And so that's something I bring through in the talks that I do, but it's a big part of what I try to push the industry to think differently about. My day job, I get to work with some amazing people on the Incena team, and where I work alongside Kat, especially on federal advisory work. And so get my feet wet in the policy side of healthcare, which of course is a big, important piece of it. And take all of the wisdom I've gained over the years as a caregiver, as a patient myself, and hopefully help our clients make smarter business decisions.
Love it. Love it. Okay, we're going to do our deck. This is like a little disorganized of a show here. We're going to do our deck real quick. Maybe you guys will know what the news says. Maybe you won't. And Lisa's on YouTube, so she can pipe in if we mess something up. Anyway, so we got a little deck here. I do want to say this, it is morel season in Georgia. Everyone get freaking excited. Very pumped. However, I've only found a few, so we'll see what happens. And one time Leslie did join me and filled a basket full of mushrooms, just like you see.
I did.
Here. So it's very exciting.
And unlike Kat, I didn't know what to do with it all because I literally had this giant bag of
it was so great.
And I need the recipe book, Kat.
Yeah, it was so great.
For all the
so what do morel mushrooms taste like? I don't think I've ever had them.
You know, here's the thing. Like, I actually don't like mushrooms. I just like to find them. Like to find them. But the morels are pretty good. To me, they just taste like standard mushrooms. They're like a little more umami-ish than others. And
like
I
dirt.
Find
like dirty dirt.
They look at
That's
how they're
less fancy, Erica.
There's
Umami.
There's a lot of dirt in there that you know does mix in with your food if you don't soak them right, which would be me. But I find some like they're very expensive to buy in the grocery store because it's like difficult to cultivate them. I actually don't know if you can because they grow on live tree roots, they don't grow on dead trees. But just in case everyone's curious, but I find so many of them that I do like poor person, low class things with them, like where I grew up, you know, because that was the move. So I like put them on pizza. You know, I just saute my own butter and pour a shit ton of heavy cream in there, like you know. Like I'm not like a fancy chef. I'm like I grew up in the middle of nowhere, so we eat.
I don't know. I just know that I'll never forget the time that you made a mushroom cake because you ran out of things to make with all your mushrooms. So.
That really happened. Yeah, the chanterelles. I had so many chanterelles that I dried them, powdered them, and used it like flour to make a chanterelle cake. We were so sick of chanterelles. So anyway, yeah, like I'm gonna go mushroom hunting tomorrow. It's gonna be great. Sergey, I do like the mushrooms. I'm just saying, I'm like it's more about the process of finding them. I feel like you understand this. Given your heritage. So feeling the vibes there. So yeah. Anyway, okay, what do we got going on? Okay, so I don't know if you guys saw LinkedIn like an hour ago. I wrote my tribute post to Lucia Savage. She retired. She's retired. Oh my God. So Lucia's had like a pretty awesome career. She was most recently the chief privacy officer at Omada Health. But before that, she was chief privacy officer for HHS or ONC. What? It doesn't matter. She worked for the government. She did a bunch of data privacy stuff. And I will say, whenever we show up, Lisa and I are like, rah, 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 health data, like treatment, operations, but like Lucia comes and throws the fuck down. It is so great. And like, it doesn't even matter if she's right or wrong. Like the way she shows up is just like, you're like, so while she's retired, I do suspect that Lucia will not, be gone from our industry. I think she's going to be around. I think she's going to take off and like do something else. Like, I don't think like a real full-time job, but I think she'll be consulting and doing cool stuff. So congratulations, Lucia. You're the best. All right. What do we got going on here? What did I say? Oh yeah. Erica, I think you posted this on our Slack channel. We got a new committee. What do you think?
Yeah, and on behalf of Grace Cordovano, who we were really hoping could join this conversation because I think she offered a really fantastic perspective on this yesterday on LinkedIn, there's not really a solid patient or caregiver voice represented in this list. And even Grace and I both were curious about, you know, where this kind of application process was really shared. So it was a little sad and disappointing to see that there wasn't as much representation on that front in this really important group of folks driving the conversation.
Yeah, I do.
You mean you're suspicious of the process, Erica? Are you sure?
I mean, I feel pretty tuned into a lot of stuff, and I didn't remember seeing anything around this. So,
yeah, I actually don't know if this is the same thing that I'm thinking of, but a lot of cool people that we work with, not necessarily clients, but people in our sphere, I did apply for something. I don't know if it was the same thing because I don't know if it was CMS. And maybe they've merged things. I don't know. But there was a call for some kind of committee. I don't know. It was like several months ago, though. But they said they had 400 applicants. I'm actually surprised if it was the same thing that I'm thinking of because like everybody said that they were applying for that. So I don't know. I don't know how to do it. Yeah. I know
Tony Robbins is on it. So don't worry, everyone. He's on it.
He's doing stuff.
It's a great list of folks. I mean, the folks here on this list are fantastic, have really accomplished careers. But like, as we've talked about before, right? Patients and caregivers need to be a part of the conversation in all of at all of the moments. They can't just be a tokenized voice that we check a box around. We have to invite them iteratively to the entire process, invite them in the room where decisions are being made. And there really just is not an adequate representation on this list, unfortunately, of folks that made it.
Yeah. Yeah. Do we think this is going to be like a useful committee? Like, do you think it's going to be leveraged? I feel like there are a lot of committees everywhere.
I mean, I have to give, a big shout out in the health tech ecosystem, the Slack channels, they do have a dedicated patient and caregiver channel. So that's great. And I really did like seeing that. So I think that this administration is very interested in that voice. I think we just need to have it pull through all the way, and it needs to be in things like this as well.
Yeah. Yeah. Dear federal government, call Erica.
Please, that'd be great.
Oh yeah. Yeah. Okay. So unrelated to patient stuff, but related to potentially privacy and like, surveillance of Americans. Everybody remembers a couple weeks ago, Pete Hegseth was like, hey, Anthropic, give me your whole model or something, or do all these things that that are surveilling Americans and could be used for bad things. Or we'll put you on the list that says you're basically a threat to America. I don't remember what it was. But it was like that. And then the Anthropic bro was like, no. And then, but then the very next day, the DoD signed a deal with OpenAI. Those guys, sellouts. But then over the weekend, basically every American with an OpenAI paid account switched to Anthropic. I feel like in general, this is a win for these guys. The judges also sided with Anthropic, saying that that was the First Amendment and that was retaliation and WTF. So I think this is great because I feel like Congress has woken up maybe a little, and I also feel like our judiciary system is also around again.
I hope so. We've missed it. I hope so. We've all been waiting. And I think it's only going to get better, hopefully, like more awoken later in the year. But this one's like it's such a land grab in general. So it's interesting that of all the things, this is one of the ones that is coming back. So we'll see. I don't know. Yeah. I don't know what is the next phase of this? Do we know?
I don't really, we had Brendan on last week to tell us legal stuff, but I think this is not the end. I think it's like a first, like, hey, you telling the government you can't do this, but I think it still has to go on and like they have to do more stuff. But anyway, it's positive. I shouldn't say that like about the justice system, like waking up. I know they were really trying to deal with things about a year ago when everything was flying out. And I do think that they tried, but like no one cared. Like they were like, what's a law? Like we're good. So I don't know.
Yeah.
Well, Leslie, you sent me this one. Drones.
Oh, this one was just fun for me because I care a lot about rural health and I think about it a lot. And so this is launching. Advocate Health is launching its first drone delivery. I think it's going to start with drugs. And I was talking to Kat about this because it would make my very blind mother who gets nervous to walk to the CVS very happy because she hates us picking up her drugs for her. So I don't know. This could be an interesting access conversation down the line.
Why does she hate it? Is she just like doing it like she doesn't want to?
She gets nervous when she crosses the paths of a human, and usually male, and of any state or sort. And but she and it's like, you live in a city, you live in downtown Atlanta, like you're gonna pass people, but she's like, I don't know. And so she started carrying mace. This is a totally different conversation. Anyway, so she's like really she loves walking places, but she gets nervous because to get the CVS, you have to do it on one corner that's not like in the normal realm of stuff. And then there's a parking lot that's a little busy. And so for my mom is not fully blind, obviously, but significantly visually impaired she's blind fully in one eye and mostly blind in the other. And so she can't see anything peripherally. So like she's one of those gray area people I talk about a lot, where it's like she's not fully blind and can't get the Medicaid services that those people can get because she's not fully blind, but she's not sighted enough to be able to do things on her own, or certainly not drive or whatever. And so, and because of where we live really close to a Kroger and a CVS and other places, so they don't deliver drugs because we're so close. So it's a really weird, like, gray area thing. So anyway, I get really excited about this, though I don't know if it's going to work, because we all remember like a couple of years ago when Amazon said they were going to start droning deliveries, and obviously no one can talk about patient data that no one owns. No one can decide who owns the air. So, it's going to work. We'll see.
Well, I hope it does. That would be great.
Nice.
Thanks, yeah. Also, another one from you. Speaking of eyes.
Yeah, speaking of eyes, again, this is probably why I look at all the things. So Cencora acquired iSouth Partners, their retina business, which is the only part of this I found interesting, except for all the zeros, because $1.1 billion is a lot of money. Is that their earnings have been very volatile, from what I understood. And so they purchased iSouth Partners' specialty of retina. So it's an MSO, but I thought that was really interesting because apparently in order to de-broadening, which is probably not a word, de-broadening their focus is what shareholders have asked for. So I'm curious if that's going to have less interesting here unless you really care about the eye space. More interesting to see if that happens in other specialties or industries. So
yeah. Huh.
We'll see.
I don't know.
We'll see.
It's always been really fascinating to me that like eye health and hearing also comes to mind too, Leslie, when I think about the limits we impose on patient populations and what they can or can't do or have access and coverage for. But then like eye health and hearing health are somehow different than the typical healthcare that we have.
Yeah.
And,
go ahead.
Oh, it's just always really fascinating to me because I think I heard a stat recently. Actually, I saw this at Rise. There was a vendor there that was talking about how hearing, if you have hearing impairment, it actually is one of the biggest correlators to dementia risk, is what they're finding. So if you're not getting hearing amplification services, your likelihood of developing dementia is like 60% more likely. It was some crazy percentage.
That's like, have y'all heard the dental one? Like if if you don't take care of your teeth, you're much more likely to have heart problems. Yeah. So
we like separate these things for some reason as if they're like other systems when they're really all integral to health outcomes that we want to have in other places. It's just very interesting and bizarre to me.
Well, I was thinking about that too, because like if you think about the people that so again, thinking about retina, because y'all, sorry, this is a little nerdy, but like I looked into this because I thought, well, I wonder if it's because ophthalmology, a lot of people get LASIK, and so that's just big dollar, right? Like and so people love a profit. But the retina business that's like older people. That doesn't usually affect anyone below 60s or something. So to your point, Erica, I mean, we have a lot of baby boomers coming up, like maybe this is a big, I don't know. There was a lot of possible implications here.
There are other populations though. I mean, that's pretty pervasive. One, steroid use, fun story. Use of topical steroids or internal steroids actually can result in detached retinas. That's a common side effect of steroid use.
Shut up.
Yeah, true story. Also, stroke populations, which are not isolated to older folks by any means. So if you have any sort of facial paralysis, you can definitely run into major eye issues as well, corneal abrasions and detached retinas as well.
Wow.
Well, I had my recent gallbladder removal, everyone, and when they do the anesthesia for a laparoscopic, they blow up your stomach, and that can cause retina detachments and retina issues. So everyone, take care of your eyes and your ears and your mouth. Everyone.
Yeah. Wow. Okay. I don't ever want to get surgery. How about
Brings
that?
a whole new meaning to head, shoulders, knees, and toes, right?
Yeah. Holy shit. What? Okay. All right. We got some other stuff going on here. It turns out, in health plan land, I think we all know the exchange plans, they went super high anyway, but this data is from 2024. And it looks like, Leslie, what do you think about this 20% denial rate? How does that compare to government plans?
So this is the highest denial rate since the original introduction of Obamacare in 2015. So this is a big deal. And there wasn't a whole lot, at least that I found, a whole lot of correlation or causation. It was just kind of pointing out what's going on. And one of the things that I thought was really interesting, but obviously y'all tell me what y'all think is, well, this isn't interesting. This is just annoying that this is from 2024 instead of 2025. Come on, guys, like we have this information. But it's it was only 1%. So the health plans like pretty much were like, well, they deserve to be denied because only one person did counter claims or whatever to the denied claims or whatever the right wording is for that.
Only 1% appealed or 1% appealed?
No, 1% of people appealed. Thank you. That's the word. Yeah. So only 1% of people appealed, as if that's an argument. It's like,
and that's how they've determined that
busy. Yeah, like I guess they feel justified because only 1% appealed, and it's like we're all busy. So I don't I mean, and a lot of people don't know how to do that. So is that the world we're going into? That was my question.
So awful because it's some outrageous number of people that doesn't even get follow-up care because it's too confusing for cancer. Like it's like, oh, we think you have cancer, and they're like, and they don't it's like some outrageous number actually don't even get the follow-up diagnostics or anything like that to confirm. So that's awful. What this actually means is probably in 2025, the data is going to show that this population is ill because they didn't get the recommended care by their providers.
Probably.
I mean, I'm really curious too, of that 1%, how many of those were accepted as a result of the appeal? Like, or were they continuing?
Oh, right.
To be
Yeah.
It did not. Yeah. That's a great question. Yeah, that wasn't mentioned, obviously.
Yeah.
Because if they all got approved, right, and that 1%, like then that is the threshold then of measurement, the denials themselves, and just automatically denying things. We've been curious about that for a long time on the prior auth front.
Yeah. That's wild. Okay. Well, we'll see what happens. Maybe the data, well, you know, as we know, as retired PR girls, like, you can make the numbers say whatever you want. So maybe next year it'll be like, you know, we saved all this money, everybody lived. It's totally cool. Depending on what slice of the population we looked at.
Yeah, there was like some like broad sweeping, like it's from like lack of full application data and, you know, duplications, but of course they didn't point to any actual information of how much of that was
that's what I'm saying.
submissions.
This concept of like weaponized incompetence is like really popular in like the marriage counseling world. I almost kind of feel like there's some vibes of that sometimes, though, when it comes to patients having their stuff.
Agree. This next story is a personal story that is unrelated to healthcare, aside from the fact that my feet hurt standing in this long TSA line. So I think you guys heard me on the last episode, I think, where I was saying that, like, I think some of the TSA reporting is a hoax. It wasn't a hoax. It's true.
I thought it was, and then you proved me wrong, Kat.
Well, I had like zipped through. So Atlanta is our home city, Leslie and mine, and I was like, whatever. Like, I do believe many of the videos I saw were AI because the ceiling was wrong. Like, I know this fucking airport, y'all. We're there a lot. But like, no, it was true. This was the international terminal at like 6 a.m. or something. I always get to the airport early because that's who I am. So like I did make it through in 90 minutes, but on the domestic side at the same time, it was about 3 hours to get through domestic. So uncool. This was also the second day of ICE being involved. I didn't see any of those guys or girls. I don't know where they were. They weren't in my terminal. Maybe they were in domestic. I did see that a lot of them were going to the domestic terminal instead of international because there were snacks. They have restaurants before you get through security and domestic. So maybe that's where they all went, but I didn't see them. But allegedly today, the president may sign either an executive order, which he could have signed months and months ago or weeks ago or whatever, to pay the TSA agents. Or they may actually, Congress may actually get a new bill in front of the president to sign. I don't know what's going to happen, but this better freaking get cleared up because I am trapped.
Well, I know this is a healthcare related except for our mental status, but like the part I don't know,
personal.
Like they have like a handful of hours because the house is piecing out. This is my favorite part. Is the house is like, we're gonna go on vacation for 2 weeks.
Yeah, see you later. Hope you guys are good.
Like unbelievable. So we'll see. I don't know.
It's the worst.
I think everyone's real mad. So it might be the executive order.
I'm big mad. So I don't care how they get paid. I would just like this is like halting commerce. Also in Atlanta, literally the only thing we have going on is traffic and our airport. So like if we cannot use our airport, there is like nothing. Honestly, our tax situation isn't even that great. We have like high corporate taxes. It's like a 7% sales tax in Fulton County. Like we have nothing else. So someone needs to fix this. I did hear. So one, we had Elon Musk on Twitter offering to pay all the TSA agents. Everybody saw that. I know you can't do that because of some law. You can't because of who knows. But did you know Tyler Perry showed up
private
yesterday?
Funding?
No, they can't.
ICE can get private funding, but
ICE is being funded through the Big Beautiful Bill.
Oh, that's right. Okay.
Yeah. But you can't like pay a government employee. I guess like bribing or I don't know. There's some reason.
Yeah.
But yesterday, Tyler Perry showed up with his posse, his crew, and he like showed up with like apparently a bunch of cash, and like tried to hand it out to the TSA, and like they couldn't take it. But apparently, it was much appreciated.
That guy's apparently fun.
Yeah. I mean,
also
like, it's like basically the ambassador of Atlanta. Like, I'm here for it. I shouldn't have said we only have the airport and traffic. We also have Tyler Perry. So we're doing okay. Anyway, Delta's super mad because this is our HQ. We got a lot going on here, and so then I guess Tuesday night or whatever, Our man Ed Bastian, CEO of Delta Airlines, number one CEO in America, did tell Congress, like, screw you, you got to stand in the big line too. So I like this guy.
So good.
I don't know if it's going to work, but I like this guy. All right, moving on to real news.
I can't with this story. I can't with this story.
Like, why?
I literally can't. I've never been least surprised by anything, and yet I still was. Just because, why not? Why not? I can't.
So I know we allegedly have a podcast that we sometimes keep up to date. For those of you who cannot see this, we're just laughing about the news that President Trump will have his signature on currency instead of the treasurer. Moving forward. Okay, and actual real healthcare news, actually real like stuff we talk about. CMMI released another model this week. It's called the Aspire model. We heard some rumors about this. It's a pediatric model. As we talked about, Leslie, with Dr. Robin Reisberg of Boston Community Pediatrics, there's like no investment in pediatrics. It's like
so
real. Sad. Yeah.
So sad.
So the Aspire model, it's for states, right? You can't just like be a pediatrician's office and like apply. It's a model for the states for Medicaid and CHIP. And it's supposed to help kind of like multi-factor care actually happen and be more facilitated. So that's kind of exciting. 5 states, it's only 5 states, but it's pretty exciting. Anyone have any thoughts and feelings about this?
I mean, it's about time. I think the saddest statement we've ever heard from both of them was that there's no money to be made with keeping children healthy. And like, that is just the saddest thing I've ever heard. So
I also don't believe it,
guys.
Right? I just feel like it's like cop out. Like, there's a lot of money to be made if we take care of our kids properly. Because it's not just the kid, right? I mean, when you look at the family unit, if you can preserve the economic potential of the parents of a medically fragile or medically complex child, there's value there. We're just not measuring it. And I think that that's the big key, is it's just not accounting for all the dynamic that's involved. It's harder.
I mean, then you get into the argument of how we need to get PEs out of healthcare, which is a whole other ballgame of conversation, but
yeah, well, it's hard. I mean, it's not, I shouldn't say like it's hard, but like the way like the reimbursements are set up and everything, right? Like, it's like, where is the immediate money coming from? It's coming from plans, right? Which is often the federal government. And if you're a pediatrician, right, your age group is limited. It's not profitable to keep a kid healthy. Children are not in ACOs. That's typically a Medicare product, so to speak. So it's like
So is this one almost like the Rural Health Transformation Fund, where this 5 you said states that were selected can kind of propose what they want this model to look like for them? Or is this something that's already been kind of developed that they're piloting in those states? I missed that.
Yeah, so I don't know a lot about it because Lisa's not here, and therefore I don't actually know. But,
Lisa, chat us up.
But in the past, like the states will propose what they want to do, and then they'll be selected.
Okay, cool. Okay, that's what I was curious. That's cool.
And
cool.
that's kind of how
that's
it usually
exciting.
is. I have no freaking idea. I'm just excited they're doing something for kids. This is modeled off Lisa should be here again, the integrated care model for kids. I think it's like InKids or something. It was a model that was released several years ago that I guess had some decent results because they're doing it again or something similar. So not totally sure. We'll have to call someone, or Lisa, I don't know if your internet works, comment here. We'll
text Steven. We'll be like, is this why you were in Texas?
Yeah. But again, I think this is going to be less exciting for our industry just because unlike the access model, every tech company in America can't actually like directly apply, right? It has to be, you have to convince a state, which as we know in our business is very difficult to do. Mm-hmm. So yeah.
Cool.
The CDC.
Oh, those guys.
This CDC. Yeah. So the 25th was the deadline to name a new nominee for director. We didn't get that. And the whole deadline is based on a bunch of rules, apparently, where you can only have 210 days of an acting director to before you get like a real nominee in there. So we passed that deadline. But surprise, they're going to let the NIH head keep doing it anyway. So
well, they have a new committee. See, Kat, they have a new
commission.
committee of advisors, so they don't need people like the head of the CDC
Well,
because they have a new, what do they say, non-binding recommendations committee
Why
or something.
have
So
rules when you don't?
listen?
Why have rules? Yeah, I do know. Like a lot of these articles were saying that that both it's a committee of people who are reviewing CDC nominees or potential nominees. Chris Klomp is obviously one of them. Who it looks like, according to media, everyone in America loves. So here for that. Same here. And then RFK is on it, and a bunch of other people up to the White House. So, like theoretically, this is going to be someone legit who can actually get through the confirmation process. So I think the
It's gotta be. You would know this obviously more than I would because of the whispers, but like, I wonder if it's just because the goal of the CDC has changed so much in the last 14 months, like where it's lived versus with a plan for it is very mushy, I feel like.
Yeah.
And even in the last couple of months, because we were doing a 180, thank goodness, on the vaccine stuff, I gotta imagine the moving target's hard to find a person that's appropriate.
Yeah. I've heard so many rumors, like a bunch of the nominee rumors out there right now are like state health officers or people who have done public health at the state level. I also heard that that's not the type of person they want. And as we know, like a lot of times when you see people in the news that isn't confirmed, it's fake. So it's just like people 100%. Doing everything and nothing at the same time. So I don't know. Because to your point, like the CDC is very different. They're 20% lighter in terms of staff. They first no vaccines. Now, even Jay Bhattacharya said apparently in a meeting this week, like encouraging people to get the measles vaccine. What? Like, so, there's like a lot going on here. There's like a lot going on. I will say shout out to our girl, Ann Zink, and her team at Yale, Pophive, which we had her on a little while ago to talk about transparent public health data, obviously de-identified. They just did launch a measles dashboard. So you can actually look and see where the measles are as compared to vaccination rates.
I hope that the entire kid program from the last slide is just going to be how to address the measles problem.
Yeah. Well, maybe they're going to be like, hey, what we're going to do.
Saving money over here.
What we're going to do is just vaccinate some kids. Yeah. I don't know. Yeah. Anyway, so we'll see. Allegedly, they are about to announce a nominee. I don't know. But I think it's going to be, it kind of has to be someone that everyone can get along with at this point because they do need to be confirmed. Also, once they are nominated, Jay can continue serving in the acting role. But right now he is not officially acting in the acting role, but he kind of is, at least from what I can tell. So whatever, I don't know. I don't really know what's going on.
Wink. Yep.
Yeah, whatever. Happens all the time. Other news about nominees. It looks like Casey Means does not have the votes and she will not advance to the vote to be the Surgeon General. Yeah. So I don't know. All the stuff I'm seeing is like Maha's not Mahaing anymore.
Yeah.
I don't know. We'll see. Oh yeah, this is interesting. Like kind of related to the 12% thing that we saw, or the whatever, the almost 20% denials for health plans for ACA plans. So this is a story about like how in Massachusetts the sepsis cases have gone like crazy up over the last decade or two. Like something like three. I don't even know if I can find it because I don't know where my stuff is. But let's just say it's gone up three times the number of sepsis cases in Massachusetts.
Right.
And what they've found is it's not because people actually have sepsis or like there's more sepsis. It's upcoding from AI tools.
Really?
They're just upcoding everything as sepsis. Not everything, but like a lot.
Why would it do that?
Like septic risk or
like they have sepsis. Yeah.
Weird.
Yeah. Which is crazy because so it's like these autonomous AI coding things. The Crush RFI, which by the way, America is due on the 30th. The crushing fraud RFI with CMS. it actually has a section in there about like autonomous coding and like upcoding and like the risk for that. And it's going to cost the government more money and it's like fake. But yeah. And there are a lot of companies out there that like, you know, that's maybe not what they say they do, but like, and they operate on contingency and they allegedly upcode.
I mean, I am absolutely 100% talking out of my ass and possibly watched too much Pitt.
Welcome to the Health Tech Talk Show.
Hey, I made it.
Yeah.
But isn't sepsis like very often contracted in healthcare settings and therefore one of the biggest lawsuit?
It can be. I mean, secondary infections are absolutely a major driver of complications from inpatient stays.
That's what I thought. Yeah. And
I'm super curious as to like what they're considering.
Agree.
Like how are they determining what's considered septic? Is it just a generalized infection and that's how they're upcoding? Like this is like really perplexing to me.
Yeah, it's like a bunch of that. It's like, well, can we like have a beer or 7 and squint? And yeah, totally cool. But yeah, it's super interesting. And then we got our girl here. What's she saying? Lisa Berry. Coding intensity, upcoding from automated tools need to be pulled back. Need more guidance from CMS and America. As we said, you should respond to the Crush RFI and tell us all about that.
I mean, isn't that the whole vision of like outcomes-based care though, that we're not letting like a diagnosis drive reimbursement, but instead actually like if somebody survives from sepsis, like they should be rewarded for that.
Right.
Crazy ideas. I don't know. Just throwing it out there.
Yeah. Well, I don't know. You know, there was
wild.
Remember there was all this like, well, there still is. There's all this like drama. Lisa, write a comment about what I'm going to say. There's all this drama about people were saying like value-based care is dead, like it doesn't work, it actually costs more money, blah, blah, blah. But like the alternative is like much like what we're seeing here, where it's like, okay, the incentive is to upcode and like do whatever, or, you know, not give a shit about kids because they don't make as much money, like take out pediatric beds because they're cheaper and we don't like that, right? So I do know the CMS, you know, Chris Klump and Dr. Oz have both said in a number of events in the past few weeks, like we are very pro value-based care, all those things. And then, you know, even as much, I believe one of the stat articles said that Chris said that, you know, should something like this, it was a hallway conversation saying, should you be auto-enrolled in Medicare Advantage as opposed to traditional Medicare? Like as much as even saying like, would we just default to the value-based or at least the, you know, the managed option to reduce some of this. I don't know. I've had some people tell me that.
I want to go back to that list of the advisors.
Oh yeah, let's go. Let's roll.
I want to audit that. I'm curious the pediatric representation on that list too, of like who's actually working in like adult medicine or adult solutions versus pediatrics. So caregivers aren't represented here too, but peds are an important population. It's our future. And if we don't care for them, then they don't become healthy adults.
I don't know if, you know, I don't know all of these people super well. I know Sebastian Cleary is the 8VC partner, Palantir Associated. Obviously, Steph and Kim are at CMS. They're smart. Dan is from Intermountain. Like, I mean, these, I think Jenny is Idaho. I don't remember seeing any pediatric representatives. That doesn't mean they aren't here.
I just asked ChatGPT, which may or may not be real, and it says no.
Okay.
It has Dr. Linda Thomas Hemek. Is that my saying it right?
Hemek, yeah.
Is family medicine. So
that's something. Yeah. Yeah. I don't know, y'all. I don't know.
Yeah.
Well, you know, sounds like a problem for another day, another talk show. Oh, here's our last slide that I made 14 minutes before.
Yes.
This is Erica giving her keynote. Just like
there were so many other good photos of me, and this is the one that keeps making the rounds. Is this like?
I like it.
Well, again, I didn't have a lot of time, so I was like, so Max, our designer at Incenna, we just did a town hall, and she had a lot of cutouts of Erica doing things, and I was like, send me the one of her presenting, and I kept getting the hilarious ones of you like doing this. So she finally did send the correct one.
This one makes me so happy, and I'll tell you why, Erica, because you have that face of like why is everyone so stupid? Like that's that face. Like that's the face you're making. It's like, why?
I make it all the time.
Why is it like this? I don't know what you're talking about, but that's what it looks like.
Yeah.
I probably said something like that too when I made this face.
Yeah. Good for you. Yeah.
Lots of rhetorical questions for my audience at that one.
Yeah.
So I feel like I'm like one of the only people who have not actually seen you speak. So
I don't
want
has
to give
either.
away. Huh?
I don't think Kat has either.
I've seen you speak. I've seen you speak before. Yeah.
She told me.
Yeah. I missed your eHealth Exchange speech, but I've seen you. You're around.
Yeah. Well, next up is Texas Hymns. So if you're going to come to Texas Hymns, come to Texas and you can see me on stage there.
Yeah, God
I'm
bless
not going to
Texas.
go to that, Erica, but I'm very happy for you.
I mean, it's Cinco de Mayo in Austin. That's fun.
Oh, yeah. I'm not going to come either. Yeah. But I got plans. But like, we look forward to posting that on LinkedIn and pretending we were there, which I think is sweet.
We'll Photoshop ourselves in.
Yeah. I don't know. So Eric,
go ahead. No, go ahead. You can ask the same thing.
I was going to ask
you.
You go.
I was well, spoiling. I was because you already mentioned earlier the like kind of what you're focused on, but what are you talking about right now? Like, what is your focus right now? Because you obviously have an extraordinary story for anyone who hasn't looked into it. But what is it you're trying to? Because it's funny. I was just talking to Kat about this earlier. Like the caregiver and the advocacy, it's just such a massive conversation. So what is it that you kind of narrowed in on, and like what is it that gets you going?
So there's kind of like two things. One is like there's this amazing patient and caregiver advocacy community, and they're bringing more and more. There's more and more visibility of those voices to conferences, which I really appreciate. So there is some attention being brought to that space. I think one of the challenges that audience or that group of people has had is that we all have these like really intense stories that sometimes are hard to connect to like operational and economic value, especially for our space. Everyone hears this story and they are like, wow, that's really moving and really like heart pulling. But what do I do with that now? That just, I feel bad. And then I have to go back and solve these problems that are systemic. And so one of the things that I've been really focused on is in my talks is what are things that we can functionally learn from the wisdom gained of that experience that we can actually turn into economic and commercial value. So that's one of the things, like the through line that I pull through when I chat with any audience in any one of these engagements. The other kind of big thing I really have been leaning in, or really that if anyone asks me, hey, Erica, how are we going to change healthcare? Like, how can we fix this tomorrow? There is this one nuance that I've learned in my own healing and recovery from being a caregiver. And that's that every single person, whether it's the patient, the caregiver, the physicians, the therapists, the policymakers, whoever it is, administrators, every single person interacting with healthcare as a system today, one is a human being with a nervous system. And we've made a gross assumption in our industry that every single person engaging with that system is doing so in a space of safety and security, where their nervous system is feeling calm. And physiologically, there's certain things that our bodies are capable of doing in that mind space. And that assumption actually is really problematic, because if you are in a state of fright or fear, or you're feeling afraid and anxious, your physiological reaction to that state is actually different. So we've made this assumption that everyone's calm and collected engaging with healthcare, when in reality, most people are actually feeling afraid and frightened and are anxious, regardless of who they are. And when you're in that mind space, your executive functioning is impaired. Your ability to act on tactical execution is not physiologically possible the more we learn about our brains and the impact of trauma. So my grand theory on how we fix healthcare for the better is actually to start with creating safety through environments and design, through language. Anything we can do to cultivate safety helps make everybody who engages with that system feel more calm. And if we can do that, then they actually can engage with the system more meaningfully. And if we have more meaningful engagement, ideally, that would translate to better health outcomes, regardless of who that is. I think we've done a lot of work on the infrastructure of our system today, and that work is not lost. I think that infrastructure is there. It's just we've made the wrong assumption out of the gate, and we can't take advantage of the infrastructure that we've actually built. So that's my grand idea, and that's what I really try to lean into and raise awareness around. Because I can tell you as a caregiver, the biggest impact on that experience has been a dysfunctional nervous system and retraining my body to feel safe when it was hypervigilant for a really, really long time.
That's wild. Leslie,
I mean,
did you feel calm when you're navigating your mother's blindness? I would guess no.
No one's calm around my mother. No, I'm kidding. Oh, no. So like, so I would say like, so I have two thoughts with that. It's very interesting. So the most palpable I've had experience with that was actually with my in-laws when my father-in-law was in the hospital back in November. He had a series of heart attacks. They were really traumatic on everyone involved. They weren't expected, blah, 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 blah. We were down there for 2 weeks. We weren't sleeping. We weren't eating correct. Obviously, like all the things, because we're in and out of the hospital. We're trying to get them transferred to a real hospital, like all these things. And I'm a fairly even-keeled person, and I feel connected, and I feel like in an industry, I had a lot of doctors and friends and people that I could call to ask questions and like figure out more information. And like if they didn't have me, even like I don't know what would have happened, just because they didn't know who to talk to or whatever. And again, this was it wasn't a rural hospital, but it was not a real hospital. And they and back to the point, like I had a situation where I was like mad. I'm not a mad person. I'm an angry person.
Yeah.
And so like I got like really, really angry in a situation. It wasn't bad. Like it was fine. Like everything was fine. But like to your point, like I reacted in a way that is wildly out of character. Or like had a reaction that was wildly out of character of like just even getting angry because I'm not an angry person. And so I think it impeded my ability to be like, to make, because again, you have to be really calm in these situations. You have to ask for all the information. You have to be really patient. You have to, which is not my forte. So I would actually agree with that. The only thought I have is that I personally think that safety comes from knowledge. And I think that that's at least partially. And so I'd be curious what your thoughts are around the only one you really specifically mentioned was the design, like why that felt to you really important. And I'm curious if it's maybe because you were a caretaker for a child. So I wonder if maybe that was is that like, why would that be the focus? Because I don't know if that would have made a difference for me in this situation. So
yeah, and maybe it was, I guess, as a caregiver of a pediatric patient, it was probably a little more unique than, an adult caring for a parent. But I think, even just thinking about the physical space of hospitals, they're not designed for like biological, like human environment, like health and wellness. You look at circadian rhythm, we've got lighting that's fluorescent, and we've made the rationalization that that's better for seeing things for the clinical teams. They're not going to miss something, but it's not designed for the human healing process. And the more we learn about the role of light and heat for our nervous system, even, or temperature and airflow, those things are not, I don't know, our bodies are a combination or a complex system of biological processes that can't be sterilized. I mean, that's part of what makes us human. And we've tried to make the whole process and delivery of healthcare sterile to preserve infectious disease risk and keep things like that from happening. And I think we need to kind of come back to what it means to be human and actually support human healing processes more intentionally and support that experience. So improve sleep. Well, if you go to a hospital, it's crazy to me that you could walk out of the hospital feeling more ill than you were coming in, especially if you're even coming into the hospital and spending meaningful time there. Right. That's just crazy. Why are somebody who's healthy walks into a hospital and walks out sicker? That makes no sense.
Yeah, it is crazy. And you to your point about light and environment, and even like there are all those studies saying a patient who is same issues in the same hotel room, hospital room, if they're the ones by the window, they get better faster. Like, that's
is
crazy.
that true?
That's true.
Wow.
Yeah,
I haven't heard that. That's
studies
interesting.
on that. Yeah, they get better faster.
The psychosis that comes from being in an inpatient environment for several days on end is real. Like at some point you do lose your orientation as to what time of day it is. And if you're there long enough, you even lose orientation of what time of year it is because you're not experiencing the environment outside. You're not going outside. Lisa made a comment here, I think, around AI. And this actually feeds in a lot to my perspective on AI. I'm a huge advocate for it. And there's a couple different reasons. The first is that I see AI, like one of the biggest untapped potentials is the ability for that tool to be something that caregivers and patients can outsource that executive functioning to when they're feeling stressed and nervous. So they can throw stuff over to ChatGPT and say, help me organize this into something I can functionally use because my brain can't handle it right now. And as a result of that, because it is connected to individual decision making and, like you said, information and education, Leslie, I think that this is really important for us as a society to advocate for AI being local to individuals as much as possible. We have to make sure that individual autonomy is protected as a human right, not something that can be monetized, commercialized, or anything like that. There's insights we can gain at scale, but before we do any of that, we have to be preserving individual autonomy first and foremost.
Yeah,
Yeah,
I agree.
I mean, I think the AI conversation will continue probably for a much longer. But as far as like where it should be, like where it should be useful, where it should be used, I certainly don't think. I think, you know what, it's a really big conversation. We can keep this, but I do think, Lisa, to your point, like, thanks for co-hosting while on a plane. But like, I think that having AI help prompt you for questions that you didn't answer or clarifying, my father-in-law really hated this one doctor, not because he was a bad doctor, but because he couldn't understand him. His accent was really thick. And he was actually probably one of the best doctors he had there, but he couldn't understand a thing the guy said. And so we had to then explain it, but then we'd forget something that he said or something. And so like even that, being able to translate information, like there's so many ways, and that wouldn't cost very much to have a bedside.
And ChatGPT is actually designed to do something right now that's actually aligned with what we understand about trauma recovery. The first phase of trauma recovery is validation. And so when you're interacting with that chat agent or chat bot, what if you experience it, right? The first thing they say is, hey, you're right, or I see you, or, very validating.
I have that turned off. It drives me nuts. Sorry, go ahead.
I leaned into that because I can tell you firsthand when I was real time freaking out if my son was having tumor progression or if we were dealing with something else, and I was checking and gut checking with ChatGPT in the emergency department. I knew it was fake. I knew it wasn't like a real interaction, a real person on the other side.
In that moment.
But at 3 a.m. and I don't have access to anything
I can see that.
Having ChatGPT say, hey, Erica, I see you. This is really hard. Yeah. That alone helped me de-escalate my nervous system response. And I could think things through more clearly and actually engage with the care more meaningfully. And I just think that there's something incredibly powerful there, even unintentionally designed from these systems today, that's happening. And I think that that's actually part of why adoption has been so amazing on ChatGPT for health, because it's helping people find calm and safety and security with these life-altering circumstances, whether it's small or big. People are trying to figure out, how can I feel safe in my body? And this tool is giving them access to something that they wouldn't have otherwise.
Shit. Well, that was a great TED Talk. Looking forward to cutting this out and posting it tomorrow. That's awesome. Well, we somehow took up pretty much our entire hour, even though I was like, I don't know, we'll show up for like 10 minutes, see what happens. So here we are. Erica, thanks for joining us and being part of our merry little band of like random thoughts and feelings on the internet about healthcare and TSA. Happens sometimes. But what do you guys want? You guys tell our loyal fans something, both of you, before we check out. Leslie and I are going out.
Yeah, we're gonna go to a garden party.
We're going out. We're going to a garden party.
I'm probably gonna go to Costco because that's how I spend my Friday nights.
Understood. Yeah, right on. I will say, I hung out with an awesome couple. They're actually sisters, but Rachel Jones. You guys remember Rachel from Syntax Health? Rachel's great. She's awesome. Yep. She came to our party. She's super great. Darshak and I hung out with her and her sister last night, who is hilarious. And her sister was telling us that during the pandemic, it wasn't Costco because they were living in the Northeast at the time. One of the big grocery stores up there. They would go there on Friday nights and dance to the music just so they could get out. Oh my God. Remember, you guys, we're in the South. Like, we didn't close. Like, these poor people couldn't get out. Right.
Yeah,
so that was their night out.
That was live music for them. Oh my God.
And they were like, she said she and her husband would dance in the aisles.
Oh my God.
So cute. Oh my God.
I mean, just to relate it back to healthcare real quick, even though I know we're out of time. Did y'all read this article recently, how Costco is going to introduce IVF like in a get offered
Yeah.
discounted IVF treatments. Yeah, that was really cool.
They're so
Costco's, like,
progressive with their
amazing.
benefits. They have so many things. They do a lot above and beyond typical companies. I'm a huge fan. I think
That's awesome.
Yeah,
Huge
Costco's a
great.
cool company. Go
Very
Costco.
cool.
You know what? Not sponsored by Costco. You guys
God
are
bless
great.
America. God bless America. Okay, you two each give our loyal fans a one-liner, and then we're out. We're out of here.
One-liner. Have a good weekend.
Always be sparkly.
All right. Okay. See you later, America. Oh, yeah.
Bye,
We're
friends.
not going to be here for 2 more weeks because, like, Lisa's on vacation. I'm on vacation. We don't know what's going on. So we'll see you in 2 weeks, probably. All right. See ya.
Bye.
Thanks, guys.